Hello everyone and welcome to Module 11, Providing Care for the Patient's Environment. At the end of this module, the aide will be able to discuss the role of the aide in caring for the patient's environment, understand why a clean home is important to the overall health and well-being of the patient, understand basic guidelines for cleaning and home management tasks, and to describe how to develop a cleaning and routine schedule.
So let's talk about the fact that aides play a big part in keeping a patient's home in order. This includes household maintenance and cleaning. Some aides report that they do not feel like home management tasks should be a part of the care that is provided. I've heard it said often, I'm an aide, not a maid. While this is true, light home management tasks are extremely important to patients. The patient's illness or disability could greatly alter or prevent the patient's ability to complete home tasks, which could lead to even more stress. Stress can have very negative effects on health and illness recovery. In addition to decreasing a patient's stress level, completing home management tasks can also be an issue of health. Examples would be COPD or chronic obstructive pulmonary disease. The patient needs an environment free from dust. The dust could exacerbate or make worse the patient's breathing and cause hospitalization. This patient will not have the energy to dust. What about the patient with CHF or congestive heart failure? This patient will not have the strength or endurance to carry a heavy basket of clothes. They may not be able to push a vacuum, etc. What about the cancer patient who's undergoing chemotherapy? This patient will be very weak and will not be able or feel like cleaning. There are very high risk infections because their immune system is low, so they are at very high risk to obtain an infection, and so a clean environment is essential to the health and well-being of this patient. What about the flu? Patients with the flu are very contagious. It is important that you wash the sheets frequently, wash the dishes in hot water. You can stop the spread of infection by infection control and home management. You are protecting yourself and others. So let's talk about why are home management tasks important. It could be possible that some patients have never learned sanitary, safety, or even grocery shopping techniques. The aides can model healthy habits to the patients. Instead of feeling like the tasks are burdensome, the aide should instead view home management tasks as an opportunity for education for their patients, to set good examples for their patients, with the hope that the patient may learn to take on more responsibility for the tasks that he or she is able to perform. It could be possible that some patients have never learned sanitary, safety, or even grocery shopping techniques. So you certainly can model healthy habits to the patients. Other duties entrusted to the aide include assisting the patient with personal hygiene, communication skills, which we've covered, nutrition, food preparation, meal planning, and organizational skills. It is important for aides to understand that they will not be expected to do any heavy cleaning. Heavy cleaning includes washing windows, scrubbing floorboards, moving furniture to vacuum, cleaning out the garage, mowing the lawn, etc. However, it is okay to move light items to clean around, for example, a wastebasket or a plant. When referring to cleaning tasks, light housekeeping is expected: dusting, vacuuming, sweeping, tidying up, etc. Duties that may also be assigned include laundry, changing linens, picking up, organizing the patient's living space, cleaning the kitchen and washing the patient's dishes, taking out the garbage, cleaning the bathroom, etc. This is important. The aide is expected to provide care only for the patient to whom he or she is assigned to. Even if the patient has other family members living in the same home, the aide is there only to assist the patient and is not there to provide care tasks for the whole family. This may cause some tension or confusion to the other family members if they have the wrong idea of who the home care aide is there to help. The aide supervisor can assist with discussing this with the family if it becomes an issue. It is important to remain sensitive to the patient's and family needs. However, it must be clear who the assigned person is that should be receiving care. Likewise, it is certainly acceptable for the aide to invite the other family members to participate in home management tasks as long as they are available and capable. Brings us to activity 1, case scenarios. So I'm going to ask that you hit the pause button. You're going to review the case scenarios with your supervisor at this point. Supervisors, there's some helpful hints in there for you. And when you've completed those, please come back. Thank you. So let's talk about developing a routine. The aide supervisor will assign home management tasks on the patient's plan of care for the aide. The aide is to follow the plan of care and to report if it needs to be changed or adjusted. The best way to begin with a patient is to lay out an organized plan. Writing out daily or weekly plans with a patient will help in setting up a routine and will help the aide to see that the tasks assigned clearly and scheduled in a way for them to be completed. For example, if the aide is assigned to do laundry once a week and assigned to change linens once a week, the aide should plan to do those tasks on the same day instead of having dirty linens pile up in the patient's home. As important as it is to develop a routine, it is equally important to allow for some flexibility. If the aide is out for the day, or if the patient has other appointments or activities for a day, the plan should accommodate this type of change. So we've talked about developing the plan and understanding that if you are going to modify it, that you do discuss that with your supervisor if there's been a reason why that plan needs to be modified, such as a physician's appointment. Let's spend some time talking about the frequency of home management tasks. Not all tasks are required to be completed on a daily basis or even a weekly basis. For example, food shopping may be assigned every other week. It would be beneficial to plan the shopping trip on a day where the aide is not doing a lot of other time-consuming or labor-intensive tasks. This again comes down to planning and scheduling. Making the bed, straightening up, and emptying trash cans, on the other hand, will most likely be done every day in which the aide is there. These tasks can be completed while the patient is eating or doing something else. Should the aide have questions about cleaning, it is always appropriate to ask the patient, since some surfaces will require special or specific care. For example, some floors are to only be washed down with water, and wood floors may need a special gentle cleanser. Never let your patients walk on wet floors. Always sweep or vacuum before washing the floors, and try to avoid waxing floors as this may become a fall hazard. So this brings us to activity 2, a cleaning schedule, and this is a classroom activity. Again, guys, hit the pause button, talk with your supervisor and other new employees that are there with you, and come back when you're ready to proceed. So let's talk about cleaning supplies and equipment, as well as writing out a routine or a schedule with the patient based on the plan of care. The aide would also benefit from familiarizing himself or herself with the household's cleaning materials and equipment, including storage or placement of these items. All cleaning supplies should be in one location, out of a child's reach, and be clearly labeled. Having to look in several different locations for supplies is time consuming, and it does not make the best use of the aide's time. Be sure to read the labels of your patient's cleaning supplies and equipment. If you are not familiar with them, it will be important to familiarize yourself with the uses and possible hazards or contraindications. Replacement parts for cleaning equipment can be expensive. Therefore, the aide should learn to use the patient's equipment before starting on a task. Please do that, guys. I cannot tell you how many times I have had to replace vacuum cleaners and other types of equipment because someone did not take the time to learn how to use the actual equipment. It's important to remember that cleaning supplies are chemicals. We've talked about that. Treat them as such. Proper usage and storage is important for your patient's health as well as your own. We've talked about never mixing any type of cleaning products. Chemical reactions could occur. We certainly do not want to have this happen. We talked about it being important to also understand that urine has ammonia in it and you should never ever apply bleach. If you did not see your MSDS or your SDS before now, it is important for you to know how to access it. So please make sure that you have talked with your supervisor and you know how to access that at any time that you are providing care to a patient. Let's talk about kitchen maintenance. When working in the kitchen, always keep sanitation on the top of your mind. Many diseases can be transmitted via food, contaminated surfaces, or dishes. Food handling is critical for elderly or sick patients. Always wash your hands after touching raw meat and always wash fresh fruits and vegetables. Always wash countertops and other surfaces that raw meat has touched. Clean dishes in hot soapy water and leave the heavily soiled items, such as pots and pans, for last. Air drying is more sanitary than drying with a dishcloth as well. Do not leave the dishes for the last part of your day. For a more sanitary kitchen, clean as you go and do not leave dirty dishes out. If there is an electric dishwasher, be sure you know how to load it correctly and how to use it properly. When cleaning out the refrigerator, be sure to use water or water with baking soda only. Never use chemical cleaners inside of the refrigerator. We'll talk more about food safety in a later module. Now, while I'm on kitchen maintenance, I'm going to share a couple of true stories with you. And I'll save the worst one for last. I have been in homes where employees were mopping and poured the dirty mop water into the kitchen sink where they provide and prepare for meals and have produce where they prepare meats, etc. Please do not empty your dirty mop water in a kitchen sink. I'm also reminded that people do in people's homes what they do in their own homes. So if this is a practice in your own home, please stop doing that. Please take your mop water, pour it down the toilet, pour it outside, but do not put it in the kitchen sink. Now, the worst for last, had an employee once, and I was sitting there documenting, and when I looked up, she was actually pouring at the time that I looked up, and she was starting to empty a bedside commode, including liquid stool, into the kitchen sink. So as I yelled for her to stop, which she did, we had a lot of conversation about why the kitchen is supposed to be sanitary, why that was not a good idea, how to dispose of that, how to use the toilet to dispose of urine and feces, etc. So please making sure that you are keeping that kitchen clean. So we are now to a handout. Handout 1, cleaning the patient's bathroom. Taking a few minutes to review that. Bathrooms can be a haven for odors, microorganisms, mold, and or mildew. It is an important room to clean. These guidelines are to assist you in the bathroom cleaning process. So let's talk about laundry. You also have a handout for that. Clean clothes, towels, and linens are very important to most people, and your patient is no exception. It is important to take care of your patient's clothes and always follow care instructions on clothes. Never wash dry clean only items. And if the clothes are especially delicate, hand washing is ideal. We're moving on to handout 3, proper body mechanics and providing care to the patient's environment. While doing laundry or other tasks, for that matter, practicing proper body mechanics is of utmost importance. Certainly, working in someone's home can be challenging. Working in your own home can be challenging. So, as outlined in handout 3, keeping your body positioned properly will help to prevent injury to yourself, especially your back. Remember to put these guidelines into practice. So, brings us to our last slide. Home management assignments may not be the home care aide's favorite task. However, they're incredibly important to the patient's overall well-being. A clean and organized home will ease your patient's stress and could also have beneficial health outcomes. Thank you guys for participating, and we'll talk with you in the next module.